standing with Lieutenant Colonel Peters, or Shay, if that's all right with you, with AFMMAST. Can you explain a little bit about who AFMMAST is?
Sure. We're the Air Force Medical Modeling and Simulation Training Central Program Office, and our office came about as a result of the Air Force Surgeon General seeing the need for simulation as our inpatient population nationwide decreases. So how are we going to keep our people current, competent, and able to sustain their training as we have to move forward into a harm's way to protect the nation and our interests?
So much like a rural hospital, you have started to implement simulation in order to increase the opportunity for training on those elements that are maybe not always readily available within the industry that you're at or the area that you're at.
Exactly. As you see things, there'll be procedures that are low volume and high risk, as an example. So you don't do them often enough to establish an ongoing level of competency. So simulation is one of the ways that we can bridge that gap, and one of the many tools that we have in the toolbox. So it's really exciting. We use that. We use serious medical gaming. We use virtual reality with avatars. So a lot of different ways, a blended learning approach to get after competency for healthcare providers.
And it's all across the nation and the world.
We have 80 programs worldwide, and we have people all over. As an example, we just began our Pacific expansion. So Elmendorf, Alaska, the joint base there, we have our coordinator and our operator they're the tier site for all of the Pacific, and they're responsible for helping all of the rest of the Pacific region with their competency.
So how long has then simulation really started to kick up and increase this program? When did this all get started?
We started under our previous general, actually our three-star general, Lieutenant General Rodman, and then our current Surgeon General, who's General Green. So began in 2009, and then continued forward to this day. Now we're the DoD Center of Excellence, and we chair the DoD Consortium with all of our sister services, our other federal partners, the VA, TMA Patient Safety, the Medical Education Training Campus in Fort Sam Houston. So we have many federal representatives. So it's really exciting.
Sounds like you have a lot of people who report to you.
A lot of people that we're just joining our efforts. So as our dollars shrink, that we can be respectful of taxpayers' money and not duplicate efforts. So when we develop technology and develop tools, all of us at the table can share those with one another, because the way we deliver healthcare ultimately is the same no matter what uniform we wear. So we can share those tools together with one paycheck, as it were, develop one aspect of technology, and then all of the partners can share that together.
Learn and share. Great. Well, thank you for sharing with us today, Shay.